One of the things I'm passionate about, and I'm known for being passionate, is getting people with cystic fibrosis the right specialist care. And as I've grown up with some of the patients I've worked with over many years, I have realised what a big difference it makes.
What is specialist care for cystic fibrosis? In my view, it is actually people. It is getting the patients together and their families, and getting the people who are going to treat them together in sufficient numbers and for sufficient time, so that they both become expert, patients and their advisors, in treating cystic fibrosis. Not having proper care meant that you got a very early infection which wasn't treated properly, and the majority of people born with cystic fibrosis who didn't get proper care died in early childhood. If you get sort of partially good care, it means you have perhaps a few reasonable years, but a miserable time otherwise. You don't have that support from people who really care about you and know you in the long term. This is the important thing, continuity of care. So it's the difference between life and death, to be honest.
We've shown over the years that people who get specialist centre care do better. They have better lung function, better nutrition, and hence have better quality of life and survival. So it's absolutely key that we maintain proper specialist care for everyone with cystic fibrosis.
Well, we're very proud of our new unit here. By unit we mean a ward that has 12 ensuite side rooms, that was built and completed in 2010 with the help of the Cystic Fibrosis Trust. Between us we raised £1 million of charitable money and had £1.5 million from the hospital, and we've created the most fantastic ward with the idea that it should be so good the patients won't actually want to leave, and built in the style of a hotel room or a penthouse suite. So we've tried to hide as much of the medical equipment as we can and make it as homely as we can, with lots of storage space, with space for beds for the families to come and stay if necessary, as well as having all the necessary medical equipment.
Both of them doctors and nurses are fine, to be fair. They're a really good team. They do look after me.
So in cystic fibrosis you need to have consultants, so senior doctors with experience of CF. You need to have physiotherapists with experience of general chest physiotherapy, but also some of the more difficult things you see in CF. We have dietitians who specialise in enhancing the diet and doing specialist feeding techniques, for example, tubes through the nose or directly